And you will feel on each other, you should feel this very smooth circular motion occurring. If you don't, if you have something that looks like this, as opposed to this, then you probably have a restricted U-joint.
Which motions are your hands doing again?
As I'm doing that, this hand is simultaneously doing that, so I'm doing this. Pushing down on one U-joint as I pull up on the other.
So U-joint would be restricted on the left side?
Don't know which side. Haven't been able to show one way or the other which one's restricted. Because it could be this one can't come down, or this one can't go up. Okay. How many questions? It's not really that difficult. I think that you're just getting a little bit tired. All we're doing is the same shearing in the neck, straight across first of all. Now to produce that, we must have this bowl-like movement and this movement intact. So if we find we lose the shear, we have to go and find out which one, or both of them, is restricted. Okay, so I would then do the side bending. Remember what I said, we do the side bending as if it's a natural movement and we're testing the passive movements. That's not natural, is it? We've already discussed that. So this is an accessory movement that we're testing. If it's restricted, it has to be regained before we can test the U-joint, because you obviously can't get this motion in the presence of blocked facets.
So side bending restriction would mean that it's either the side seal or the U-joint.
Still, you can't say which one of these different.
The side bending restriction tells me it's either the Z-joint or the Z-joint and the U-joint, but the Z-joint has to be affected.
How are you stabilizing with your side bending?
Just bridging, yep. And
If
fixing.
the side bend isn't restricted, but the shear was, then you would say it was the umbilical.
Quite likely, but I still need to test it. If I test the U-joint out like this, and I think, well, that feels free enough, then I go back to my original concept. Maybe this is so sensitive on this side that when I pushed on it, the muscles went into hypertonus and blocked my movement. The other thing with U-joints is, because they're right on the axis of flexion and extension, flexion and extension does not change them. So we find we've got a restricted shear test in all three positions.
Yeah, which joint? The
U-joint. Any questions? Okay.
If they're not affecting flexion and extension, then why originally did you check in 3 positions?
For the whole segment.
For the facets and
Yeah, this for everything. There's muscles involved here that could affect that movement.
Well, I'm a little confused on what you're calling side bending and how that differs from what you're calling when you check the U-joints.
Okay. Side bending will occur around a different axis.
So are you calling the translation for side bending? That's what I'm saying.
No, not really. The Z joints move like this, and because they rotate as they side bend, they must be on a very oblique axis. and that oblique axis must fall within the disc. U-joint movement, which is this motion, has a much more coronal axis, and it must be in the vertebral body because the movement's occurring in the disc. It's quite different. Quite a different feel too. You've got to feel it before you can understand it. Okay, I'm going to move on, make sure I finish this. If this were a left facet on the left that couldn't extend, again I would mobilize, very similar to the AO joints, extend, right shear, take up any slack in the side bending. Don't let me lift your ear up. Relax. As she relaxes, I take up the side bending slack. Hold. Relax. Hold. Relax. I get to a point where I can no longer use the hold relax, so I begin soft tissue articulation. See? Principles are all the same, there's no real difference. Just different hand placement. So as I push to facilitate that movement, as I'm pushing the left facet down and to the right, I'm now pulling the right facet up to the right. With enough irritation of the joint, I can then see if muscle energy starts to give me more movement again.
What stabilizes? What are you stabilizing it for? You're moving one down, don't you have to stabilize with the other hand? So it's a joints below one.
Not really, and this is the trick. So far we've looked at what's happening to the segment that we move. So I take the head, C3-4, and I shear it to the right. C3-4, side bends left. What happens below C3-4? Come and have a look.
Well, they look like they're going that way.
This way?
Yeah.
So what do you call that? What do you call that?
Side bent right.
Okay. Same as that, isn't it?
Mm-hmm.
So I shear at C3-4. C3-4 goes into left side bending, but the lower cervical spine is in right side bending.
So they're basically...
Incongruent. So you don't have to fix. This is one of the beauties of this technique, is you don't have to use complicated fixing techniques. Just by doing the shear, you will lock up from below and above. This is particularly useful in those conditions that we would normally call foraminal compression. And I'm very doubtful if foraminal compression ever exists as a primary condition. So this person who comes in with pain and tingling in their arm, the side bending and extension aggravates it, get a history from them. Have they been involved in some kind of trauma? Could they explain this? Probably not. So what are you looking for? You're looking at a higher joint which has got stuck and is now forcing the lower one to compensate. So in this case, I could end up with left C7 symptoms from a block at C3-4. C3-4 can't left side bend, it's held this way. And as we said on the very first day, can you remember that? Eyes always stay level. Universal law. So something has to left side bend. So the neurophysiological law of suckers comes in. Anything that can move is going to be made to move. And of course, the weak links in the chain will be the first ones to be picked on. Weakest link in the chain of the cervical spine. 5-6 is the commonest one. That's the one that's broken down. That's the commonest referred arm pain. But it may be 6-7. So we have to try and side bend, mobilize into left side bending at C3-4 without closing the foramen down. Now before you puzzle too much longer, you've already done it. Because by doing this, you've put the left C3-4 into left side bending, but the rest of the spine is in right side bending. The foramen is wide open. Very good technique for that treatment.
Can you review what you're doing then? Facet modulation?
Okay. The other way of doing that is fixing and side bending. The other way of trying to do it is to take the facet and push down. So the angle I'm pushing down at is towards her right foot with the left facet, and I'm pulling up away from her right foot. So same kind of movement, but very much shallower.
That's what you already showed us, right? That's what we did.
That's facet. No, I'm giving this one.
Right.
You can try it this. No, that is quite different. Look at her face. Her face, when I do that, is going into left side bending and left rotation. Yes? As opposed to this. That's a very different movement. Now, you can't see that at the moment because you haven't done it. But when you've done it, you'll say, well, of course it's different. Look at the, I mean, even the head and the face are moving completely different planes. When you come to manipulate, which hopefully maybe next year sometime, this is an important point because you can have an instability in a facet joint caused by hypomobility in the U-joint. The same U-joint is screwing up the axis of movement. So you have to be able to manipulate both of them. And your whole training in this course is built around preparing you for manipulation. The concept that we don't treat whole segments, we treat one joint going up or down. That's all. But you've got to be able to narrow it down in your own mind to say, yes, I know what that is. It's a left facet that can't extend. And I've worked it out, got this far. Okay, any questions before we practice that? Okay, so we'll practice that for a few minutes. I can't see what the time is. I'm in a complete mist. Okay. Then, just before I finish, I'm going to show you a locking technique that you can use in the more acute, subacute patients that will help us lock down to these joints to remove some of the stress. Using the most sophisticated locking technique ever devised, called the craniovertebral locking technique. Okay, so let's practice this one first. Okay, model. Oh, that's good. Okay, two things now before we finish. Move down the bed a bit. U-joint treatment. Same starting position. Shear to the level of the restriction. Resist. Look at my hands though, slightly different. My hands are over the side, the lateral processes, rather than the facets. Don't let me pull your left ear up. Relax. As he relaxes, the slack I need to take up now, of course, is not side bending. It's this. Hold again. relax, hold, relax, push. So it's that shearing movement with the bowl-like action is what I need to take up. And in most of these people, a couple of hold relaxes, on your second push you're going to feel it go crunch. Now don't worry about that, that's just the sort of arthrotic nature of that joint.
You said that your hands were at the lateral aspects.
Z joints, I had them like this. And to get the movement out of them I was doing a downward lateral movement, but it was also going this way. Same time this joint was going up like this, so we got this very oblique axis of movement. With the U joints it's simply this. Much simpler movement. And I'm just telling you some of the things you can mess around with over the next year, experimenting before you come up against your level 4 exam, level 4 course. And it will make things much easier if you've played around with it in the meantime.
When you translate right, you resist the left ear.
Translate, yes. Right shearing is left side bending. Okay, you sit up for me. Here's a locking technique for those of you who are doing specific techniques. One of the problems with the way we've been taught before, side bend down to the level. Rotate in the opposite direction. So by the time I've got down to the lower cervical spine, this person's neck is in a comfortable and almost precarious position. Rotated and side bent like that, especially for the artery. Let me show you another technique that is based on Olaf Evanient's attempt to maintain a relatively low tension in the vertebral artery, but in doing so has produced one of the most efficient locking techniques. He sees the main danger point of the vertebral artery at C23. This is where the axis is really swirling around. So he likes to keep that in neutral. And to keep that in neutral, what he does is he side bends, and as soon as he starts to side bend, he feels the spinous process of C2 come into his thumb. So he derotates it, brings it back to midline. Side bends a little bit more, feels it in his thumb, derotates it. Side bend, derotate. So now no matter how hard I can move now, he's locked. So obviously that's congruent locking in the craniovertebral joints. I'm then going to continue on locking down to the level. Relax for me. Lost it. Okay, just relax now. Continuing on to side bend to the level, he locks at that point, which is considerably less tortuous than the one we had originally. Why is this? When we do normal movements, there is a synergy between the cervical joints and the craniovertebral joints. What do you understand by a synergy?
Work well together.
Hmm?
They work well together.
That's a partnership. A synergy is where the combined effect is greater than the sum of the two individual effects. So if we look at the amount of side bending that can come in the craniovertebral joints, and then the amount of side bending that can occur in the lower cervical, we come up with a certain figure that is far exceeded when we move them together. So we've got to block that synergy by making them move independently. So we lock up the craniovertebral joints first with a congruent lock. We then go into side bending in the cervical spine. But while we're holding the craniovertebral joints locked, we are preventing the cervical spine from left rotating. It can left side bend, but it can't left rotate. Therefore, we have virtually got an incongruent locking technique down the cervical spine. And to be able to lock up that quickly means that your artery is a lot safer, and the leverage through your head and neck is going to be a lot safer too, with less rotation involved. You could say, well, hang on, what's the difference? Didn't we just do that at first? We did, but we allowed them to combine. The only difference is that we are blocking the synergic movement by doing them individually. Okay, so once I'm locked up in this position, I can do my specific traction. I can do my mobilization. But it's going to be a lot easier now with this technique than with your old techniques.
And once again, you lock the upper cervical by keeping C2 in a neutral position.
Yep, not fixing anything, but I'm side bending. I can feel C2 rotate, so I do rotate it. Side bend a bit more, I feel it rotate, so I do rotate it. So there it's locked.
Then you just side bend directly from there, even when you're...
Then I side bend directly. So if I was trying to, in this position, if I was trying to regain flexion, left side bending in flexion, which this would be set up for, I would then side bend down to the level. I would then flex, and I'm ready for my the technique to begin. So in this case, if I was doing flexion to the left, which facet am I treating? The right facet. So the right facet goes up, superior facet goes up, or inferior facet comes down. That's the trick. So we're going to bring this inferior facet by hooking my thumb over the transverse process. So I'm dealing with 5-6. Hook my thumb over the transverse process of 6, hook this around the lamina on the left, and I'm going to rotate it right. Of course, as I rotate C6 to the right, I will be pulling the right facet, the inferior facet, down and back. Like so. Okay, well, enough trauma for one weekend. We'll leave it there. So I anticipate seeing you all in January. January? Or at least anticipating seeing some of you in that time, but I will look forward to seeing you all in May, by which time you will all be polished to a fine edge, I'm sure. Okay? So until then, have a good Christmas. And if you have any problems, just contact Anne. Okay.
I want to quickly ask you,